Yeah, no worries, guys. We will start our session now. It is 9:15 now. If anyone comes, they will attend in the middle. So today is July 9th, fast quarter 21's free CPC prep and SDS session 33 musculoskeletal system coding. So if you want to know about fast quarter 21, please type fast quarter 21 medical coding YouTube channel in the Google. Directly it will lead to you our channel. So we will, without any delay, we will start our session now. So yeah, go ahead and try to answer this. First one, what modifier should you report when the same physician provided a re-reduction of a fracture? So now it is 9:15. We will discuss the answer at 9:18. So try to refer all modifiers. You can find the correct answer. Yeah, great, Kim. Great. Yeah, that is the thing you need to pass the CPC exam. Spontaneous uh, action we need while writing the CPC. But anyway, modifiers are very important during CPC as well as in live coding also. If you have good understanding of modifiers, na, you can do wonders. Yeah, correct. So Sarika, Lucky, yeah, good. Good, Lucky, keep it up. Anyway, I know about you. You are good. You are doing good job during our sessions. Surely you can pass your CPC. No worries. So if you have any difficulty during reading or if you don't understand anything, hi Neeraj, good evening. So just send your question to our email ID. I will try to answer your concern. So good job, Neeraj. So now time is over. Hi Cinderella, good evening. Yeah, no worries. So basically here our answer is A 76, which is correct answer, which is provided by the most of the coders. Yeah, 76 is the correct modifier. So what is 76 here? Modifier 76 is used to indicate a procedure or services was repeated by the same physician. So here if you see our document, what modifier should you report when the same physician provided a re-reduction of a fracture? So here we need to use the 76 modifier based on the modifier description as this services are provided by the same physician. So 77 is for different physician and 59 is for separate procedure, but it is not a separate procedure and this reduction is not performing by the another physician. So this reduction is performing by the same physician who provided the initial reduction. So here our answer is A, which is 76. Yeah, thank you, Cinderella. So we will go ahead and learn second question. So now it is 10:20. So we will discuss the answer at 10:24. So just try to remember the all the answers, and modifiers are very important. So try to concentrate more on the modifiers. Just you need to compare the our question with the code descriptions. We no need to do any more hard work here. Thank you, Nilesh. Yeah, thank you, Cinderella. Thank you for your answer. Thank you, Lucky. So just while coding or choosing the CPT code, please check the descriptions on the selected code, like top three codes and bottom three codes for selected code, so that you can understand the differences, your selected code and other codes. So you guys are having 1 minute to answer. Yeah, night time over, we will check. So whenever you code a CPT procedure, we need to check the medical necessity. So what is medical necessity? So basically we need to check LCDs and NCDs in order to find whether the coded CPT is reasonable to code along with the ICD-10 CM code. So we will start our analyzation. So this is a 26-year-old female who presents today with sacroiliitis. So sacroiliitis means it is like inflammation of the sacroiliac joint. So on the physical exam, there was pain and palpation of the left sacroiliac joint, and fluoroscopic guidance was done for the needle positioning. Okay, so these are the keywords here. One is the location. So sacroiliac joint is the location, which is the keyword, and fluoroscopic guidance is the keyword. So you need to make both of them keywords so far. So then 80 milligrams of depomedrol and 1 ml of bupivacaine at 0.5% was injected into the left sacroiliac joint with a 22 gauge needle. So the patient was able to walk from the exam room without difficulty. Follow-up will be as needed. The correct CPT code is. So basically here we need to understand the code description. So for example, if you take 20551, basically this is for tendon sheath. So here 20551, physician will do injection for tendon sheath. But based on our report or documentation, physician performed injection on sacroiliac joint using the fluoroscopic guidance. And we will check 20610. Basically 20610 is for arthrocentesis. So here physician did not perform arthrocentesis or injection. So he has performed on the sacroiliac joint. So 20610 is for remaining major joints, not for sacroiliac joint. And 27096 LT 7703 26 modifier. Basically 27096 is correct answer, but the thing is that, so if you check 27096, one second. So if you check 20796, we have one guideline. 27096 is used to be used only with CT or fluoroscopic imaging confirmation of intraarticular needle positioning. So based on our documentation, physician has used fluoroscopic guidance. So we need to code fluoroscopy here. Why means 27096 already is having the fluoroscopy. So our B is also wrong. So here we are left with C. 27096 is the correct answer. So lucky, basically 27096 code itself is having the fluoroscopic guidance. So we no need to code separately. So if you check the your CPT book under say 27096, we have one guideline. See here 27096 is used to be used only with CTR fluoroscopy imaging confirmation of intra-articular needle positioning. So if you check the code description, injection procedure for sacroiliac joint, anesthetic steroid with imaging guidance, which includes fluoroscopy or CT, including arthrography when performed. So here our answer is C. C is the correct answer. Lucky you need to analyze this one. So everyone got guys this one? Any doubt here? Okay, no worries. So directly you need to check the code description along with the parenthesis guidelines related to that code. Okay, then we will go to third question. Yeah, now time is 9:28. We will check the answer at 9:32. Yeah, just to you need to concentrate on the code description. You need to read code description well. Yeah, thank you, Lucky. Thank you very much. Just nothing secret here. Just you need to compare. Comparison needed. And if you check the comparison, just you need to concentrate more on the code descriptions. So you need to do multiple work in order to understand the code descriptions. Yeah, thank you, Cinderella. So you have 1 more minute. So basically, I am going more time, but in CPC exam, I think you need to write within 1 to 2 minutes. But as it is a learning session, I am providing more time. Yeah, no worries. So now time is over. Just we will analyze our scenario. So a 45-year-old gentleman with a history of fall while intoxicated suffer a blow to the forehead and imaging revealed a posteriorly displaced wooden-tied fracture. So this is the keyword here. So the patient was taken to the operating room and placed supine on the operating room. Okay, so yeah. So supine is the keyword here. So basically, whenever we code spine procedures, position of the patient plays very important role. So we need to check the position of the patient. So the patient was taken to the okay fine supine position on the operating room table. Under mild sedation, the patient was placed in Gardner Well strongs and gentle axial traction under fluoroscopy was performed to gently try to reduce the fracture. So here fluoroscopy is the keyword. It did reduce partially without any change in the neurologic examination. So more manipulation would be necessary and it was decided to intubate and use fiber optic technique. Okay. The anterior neck was prepped and draped and incision was made in the skin crease. So basically here physician is making the incision. So we need to consider it as open procedure. So it is a open procedure now. Skin crease overlaying the C4 to C5 area. So using handheld retractors, the ventral aspect of the spine was identified and the C2 C3 disc space was identified using lateral fluoroscopy. So using some pressure upon the ventral aspect of the C2 body, we are able to achieve satisfactory reduction of the fracture. So here physician has performed the fracture reduction. Under direct AP and lateral fluoroscopic guidance, a Kirchner wire was advanced into the C2 body through the fracture line and into the odontoid process. This was then drilled and a 42 millimeter cannulated lag screw was advanced through the C2 body and into the odontoid process. What procedure code should be used? So we will check 22205. I think I could not find that one here. So we will check 22305. So basically 22305 is for where is this? I can't find that also. I think my book is old. I can't find that one. So we will check 22315. Sorry, 22, yeah, 22505 is manipulation of spine requiring anesthesia any region, but our region is cervical area. So 22505 is wrong answer. So means VA is wrong. We will check 22305 if you find 22305 here. So I can't find 22305 on the book. So we will check 22315 now. So 22315 is closed treatment of vertebral fracture. But based on our operator report, it is a open procedure. Yeah, thank you, Lucky. Yeah, it is deleted as I am using the old version book. See here, as I told you, using our keywords, it is a open procedure as physician has made the incision here. So 22315 is for basically for closed procedure. So 22315 is also wrong. So we are left with 22318, which is the correct answer. If you check the description, open treatment under reduction of odontid fracture and or dislocations, including uh, OS odontodium anterior approach. So here physician placed the patient in the supine position and he made the anterior neck. See, here is the position of the patient anterior side. So here 22318 is the correct answer based on our keywords and our code description. Okay guys, any doubt here? So 22318 is the correct answer. Thank you, Lucky. So go ahead and try for this one. Fourth one. So now it is 9:39. We will check the answer at 9:42. Oh, sorry. So I am trying to make you visible to all of. Yeah. Thank you, Neeraj. So that's why it is. I am using old book, so I could not find it. So anyway, thanks for information. Yeah, just try to answer this one. So we will check the answer at 9:43. So now it is 9:39. We will check the answer at 9:43. So just nothing secret here. Just you need to check the like what do you call code descriptions and our operative procedure. So basically, spine procedures are little bit confusing. So, but uh, patient's position plays very important role in spinal procedures. So whenever you are coding CPT procedures, you need to know the anatomy. Try to use your anatomy book to identify the exact location of the fracture so that it will be very easy for you. So you have 1 more minute left. Yeah, thank you, Surinder. Good evening. So please click on like button so that this video goes to more people. So they will be get help because of you. So if you forget to click on like button, please click on that now. Yeah, good evening, Surinder. So yeah, now time is over. We will discuss this answer. So right, yeah, no worries, Lucky. Just to keep concentration. So don't divert your mind. Just to whenever you do CPC exam, na, just you need to have more concentration. So right scaphoid fracture, open reduction and internal fixation of right scaphoid fracture. So the patient was brought to the operating room, anesthesia having been admitted, the right upper extremity. So this is the keyword here. So whenever we code any procedure, we need to know exact location. So here right upper extremity is the keyword. The limb is extended and pneumatic. Okay, an incision. This is the keyword. So incision means, as we all of us know, it is a open procedure over the dorsal radial aspect of the right wrist. Okay, skin flaps were elevated, cutaneous nerve branches were identified and very gently retracted. The interval between the second and third dorsal compartment tendons were identified and entered. The respective tendons were retracted. A dorsal capsulotomy incision was made and the fracture was visualized. There did not appear to be any type of significant defect at the fracture site. So a 0 point, so this is also very key important keyword here. So you need to remember, then used as a guide wire extending from the proximal pole of the scaphoid distalward. The guide wire was positioned appropriately and then measured. A 25 mm AccuTrack drill bit was used to in order to make a drill to 25 mm. A 22.5, okay, these are very common. So basically, the most important thing we need to remember here is in fracture reductions or fracture repair, we have three types of procedure. So one is open procedure, second one is closed procedure, and third one is percutaneous procedure. So how do you identify? So for example, if the physician creates any incision on the skin or fracture site, it will become open procedure. And without creating any incision on the fracture site, if physician reduces fracture, it will become closed procedure. So only manipulation will be done using the fluoroscopy here. In percutaneous fixation, physician will not make any incision, just he will insert the screws or wire into the fracture site. So based on the complexity of the fracture, physician will decide what to do perform, whether I can do open procedure, closed procedure or percutaneous pinning. So based on our code description, and physician also made incision here, and also physician has used the internal fixation here using the guide wire and these pins. These are the pins. Kirchner wire was then, these are the pins and wires. So based on our type of procedure, it is a open reduction and internal fixation of right scaphoid fracture. Among these four codes, we have closed procedure, open procedure, and also percutaneous pinning. But based on our operative report, it is a open internal ORF, open reduction and internal fixation of right scaphoid fracture. So here our answer is 25628. So remaining all are, one is closed procedure, one is percutaneous procedure, but based on our operator report, it is a open procedure. So here our answer will become 25628, right? So A is the correct answer here. Okay guys, good job, all are doing good. So go ahead and try to solve this one. So now it is 9:46. We will check the answer, sorry, 9:47. We will check the answer at 9:49. So as it is So basically you can use these sessions for your same day surgery coding also. If you go to any interviews na, they will ask only this one. So you can use these sessions for CPC exam as well as the same day surgery question and answers also. Yeah, now time over we will discuss. So the surgeon performs a diagnostic endoscopy on a Medicare patient, followed by a surgical endoscopy in the same family. How should you code? So as all of us know, based on CPT guidelines, always surgical endoscopy includes diagnostic endoscopy. So here our answer is B, report only the surgical endoscopy. So most of the people wrote the correct answer. No worries. So, but basically this is a basic guideline of CPT, like endoscopy procedures. So you need to remember surgical arthroscopy includes diagnostic arthroscopy or endoscopy. Yeah, B is the correct answer here. Next we will check sixth one. So now it is 29:49. We will discuss the answer at 9:52. Yeah, if anyone completed this one, just to keep it in the chat box. Yeah, no worries. We will discuss whatever you know, just to mention in the chat box. So just in order to code properly, you need to find the keywords first. You have 1 more minute now. So now time over. So which procedure would be reported when a patient had all 5 toes on a single foot amputated at the metatarsal? So here metatarsals is the keyword. So you need to remember this is the keyword here. So we will check first 27888. So 27888 is for amputation ankle through the manula of tibia and fibula. So basically it is not ankle. So this is the metatarsal. So we can eliminate 27888 and we will check 28800. So basically 28800 is for amputation foot mid-tarsal. But based on our documentation, it is metatarsal. So if you check 28805, it is metatarsal. Amputation foot metatars transmetatarsal. So if you see here, physician has mentioned the metatarsal. So here our answer is B, 28805. So what is 28820? Amputation to metatarso phalangeal joint. But here, based on our operative report, we have amputation at the site of only at the metatarsal, not at the metatarso phalangeal joint. So here our answer is 28805, which is B. Yeah, most of the coders wrote correct answer. 28805 is the correct answer, which is B. So Srinath, you need to remember D is wrong as D is for metatarsophalangeal joint, not for metatarsals. And A is for mid-tarsal, not metatarsal. So that's why I told you just we need to remember or we need to identify the correct keyword. See here it is metatarsal, not mid-tarsal. Okay guys? Okay, no worries. Just to try to remember these keywords when coding the operative reports. Okay, we'll go ahead with the seventh question now. Yeah, now it is 9:55. We will discuss the answer at 9:57. D is wrong, Sarika. B is the correct answer. So D is for metatarsophalangeal joint. So our here physician performed only metatarsals, metatarsal amputation. So you need to remember that metatarsal is different, metatarsophalangeal joint is different. So yeah, so you have 1 more minute to answer this. So now time over. So which of the following is a method to treat fractures where a fixation such as rod or nail is placed across the fracture? So basically just now we have discussed these keywords. So whenever you see or whenever physician needs to perform open procedures, he need to make a incision. But in this our documentation there is no incision. So we can eliminate open. So we can eliminate A here and we are left with B closed. It is in closed fracture, physician will not perform any rods or nails. just using the manual application, he will reduce the fracture site. So basically endoscopy is not a correct answer here. So and D is the correct answer, percutaneous pinning. So which of the following is a method to treat fractures where a fixation such as rod or nail is placed across the fracture. So it is a directly in percutaneous fixation, physician will not make any incision. So directly he will make the drill or and he will put the pin inside the fracture site. So because of that reason, this is the D. Percutaneous pinning is the correct answer here. So not A. So in order to code A, physician needs to perform a incision, but there is no incision here. So no worries, try to remember these keywords: open, closed, and percutaneous procedures. Those are very important for orthopedic or musculoskeletal system coding. So as soon as you see the operator report, you need to identify which type of or which approach is using by the physician or used by the physician. So no worries, try to remember that. So try to answer eighth question. Now it is 10:58. We will discuss the answer at 10:59. We will discuss the answer at 10:02. So always remember to learn the modifiers. Those are very important. So you have 2 more minutes. So no problem, Neeraj. We need to remember all these keywords while coding operative reports. Yeah, thank you, Srikanth. So we are left with 1 minute. Thank you, Lucky. So now time is over. We will check our answer now. So what is this series? Yeah, okay. So a 21-year-old football player fell to his knee on being tackled. Okay. So this is the here knee is the keyword. The impact was so severe that he suffered a broken left tibia. Okay, tibia. It's fine. A medic was called onto the field and the man was transported to the nearest ER. Okay. 2 days later, an orthopedic surgeon repaired the fracture by placing 4 screws into the injured area under fluoroscopic guidance. The correct CPT code for this procedure is. So what is 2 double? So basically you need to understand that it is a percutaneous pinning. So here it is a not open procedure as physician did not make any incision here and physician has not performed any reduction here. So whether it is not a closed procedure. So it is a percutaneous procedure. If you check 27750, it is a closed treatment. But based on the documentation, physician has performed the percutaneous pinning, not closed treatment. So what is 27752? So this is also wrong. Closed treatment of tibia shaft fracture with manipulation. So 27752 is also closed treatment. We will check 27758. So 27758 is open treatment. As it is not a open treatment, patient did not perform any incision here. So we are left with C. So 27756 LT is the correct answer. So C is the correct answer here. Thank you guys. So just as I told you previously, you need to remember what is the approach physician used by in order to treat the fracture site. Yeah, thank you Vijay Lakshmi. Good evening. Yeah, go ahead and check ninth one. So now it is 10:04. We will discuss the answer at 10:07. So you need to remember these basic guidelines like what is open fracture, what is closed fracture, what is percutaneous pinning. These are very important in order to code properly. So if you know those differences, now you can code properly. If you don't know, it is very difficult to code proper code. Just you need to find the approach. So if you identify correct approach, you can code easily. Yeah, now time is over. So we will discuss this answer. So which CPT code should you report when physician performs an endoscopic gastrocnemius recession? Oh, yeah, write your answers in the chat box if anyone completes. So we will discuss here which CPT code should you report when a physician performs an endoscopic gastrocnemius recession. So it is basically here what is our keyword? Here our keyword is endoscopic procedure. Okay. So you need to remember this is a endoscopic procedure. So we will check A 27687. What is 27687? Which is a gastrocnemius recession, which is a open procedure. So there is no mention of endoscopy in the code description of 27687. So we will eliminate answer A. As here physician performed endoscopic procedure, we can't code open procedure code here. As 27687 is the open procedure, but here physician performed endoscopic procedure. So we can eliminate 27687. So even 52 modifier is for reduced services, but here there is no reduction of services by the physician. So 29893 is for fasciotomy, endoscopic plantar fasciotomy. So basically physician did not perform any fasciotomy here. So we are left with answer B. So here our answer is 29,999, which is B. So B is the correct answer here. As I told you, we need to understand what is a open procedure, what is a closed procedure, what is a percutaneous procedure, what is endoscopic procedure. And also you need to read the operative report properly. See here it is an endoscopic procedure. We can't code a open procedure for endoscopic procedure. If you don't have the code, we need to code unlisted code. Okay guys. So today we will complete our session here. I don't want to waste your valuable weekend. So basically it is endoscopic procedure na. So that's why 27687 is the close open procedure. So we can't code open procedure for endoscopic procedure. So D is 29893, which is different scenario. So that is for endoscopic plantar fasciotomy. That is different procedure. Plantar fasciotomy means it is like a foot area, plantar area fasciotomy. So basically physician is going to release nerves or muscles in the plantar area. Yeah. Basically, arthroscope is also one type of endoscope. So that is the reason our answer is 29999. So if we don't have correct answer in the CPT book, we need to use unlisted procedure code here. So D is for plantar fasciotomy using the endoscopic procedure, but here physician did not perform any plantar fasciotomy. Physician performed gastrocnemius recession. Yeah, now it is 10:11. So I will stay until 10:15. So basically arthroscopy, endoscopy both are same only. So endoscopy is the common term for all scopy procedures. So arthroscopy means joint scopy. Endo means inside the joint. So 27687 is the open procedure. We can't code for our endoscopic procedure. So if that like code description does not have open or endoscopic, we need to consider it as open procedure, not endoscopic. So here they did not mention that it is a endoscopic procedure. If you check the description, 27687 gastrocnemius recession strayer procedure. They did not mention anything here means it is a open procedure, not endoscopic. If it is endoscopy, they will mention it is a endoscopic procedure. For example, if you see 29893, they are mentioning endoscopic plantar fasciotomy. Like that, physician needs to mention whether it is colonoscopy, EGD, everything physician needs to mention. So here physician did not mention anything. So in our scenario, he mentioned endoscopic. So that's why our answer is we don't have correct procedure code for this gastrocnemius recession. So we need to code unlisted code here. So okay guys, so we have 2 more minutes here. So if you have any doubts, we can discuss. Yeah, no worries, Neeraj. So as we have discussed previously, we need to understand the approach used by the physician in all these procedures. So we have 1 more minute. So whenever you have any problem, just mention in the comment section of our videos. So I will try to answer. Which course? So Navid, so our live chat training. You are asking about our live chat training. So basically it is 35 to 45 days duration only on weekends, daily 2 hours. So I need to decide Lucky. So anyway, I will mention in the our WhatsApp groups. Just you can find. Yeah, welcome Nilesh. Thank you very much. So any one of your friends are looking for same day surgery live chat coding training, we are going to provide from next week onwards. It is not a free training, it is a paid training. So basically there you are going to learn live SDS chats, nearly 60 to 70 chats, along with you are going to learn most important and very crucial question and answers for same day surgery interviews. So what course would you like to have, Navid? Yeah, welcome Cinderella, welcome Neeraj. So just tell me the course name. What course would you like to have in medical coding? So now send your details to Vincent Medical Coder at the rate of gmail.com. So Sheikh, for what course you are asking? This course, live chat training. So it is basically 3500. So it is nearly 35 to 45 days duration. Yeah, it is not complete SDS. Basically, it is for complete live chat training. For example, if you want to take complete SDS training, it will cost you 10,000. But ours is only live chat training along with most important same day surgery Q&A for interview process. Yeah. Okay, guys. Yeah. Yeah, of course. So you can attend our demo, Sheikh. Afterwards, we can decide. So if you want to attend our demo, send your details to cpt surgery3@gmail.com. There you will find all the information related to this course.